Hi, Tom.
Hi, Hiroshi. Good
Yeah.
morning from Italy.
Yeah, from Italy, it is good morning, and for me, good afternoon.
Yes,
Yep.
yes, I know. I
Yeah.
know. It's very nice to speak with you.
Yeah, thank you. And also, I'm afraid to ask you because Italy had a really hard time, and I hope that your family and everybody is all right.
Yes, yes, our family is well. We are fortunate because where we live in central Italy, in Tuscany,
Mm-hmm.
the number of cases has not been as intense as in northern Italy. Interestingly enough, my wife's family comes from Bergamo, which was actually the epicenter of the
Yeah.
outbreak in the Lombardy in northern Italy, but they are safe as well. And we are doing our best to follow the orders of social distancing and respecting the guidelines about staying inside. And we're very hopeful that this has worked well. The last 2 days, we've seen some positive numbers.
That's good to know.
After about 3 weeks of very, very bad numbers. Yesterday and today, the number of cases has dropped, the number of deaths has dropped. So we hope we can start feeling optimistic very soon.
So, which means that maybe you may hit the apex.
Yes, I think maybe we hit the apex probably about 3 days ago, Hiroshi.
Oh, good.
And just in time, because the doctors and the nurses have been incredible, working 24-hour shifts day after day after day. And unfortunately, they have been the ones that have suffered a lot. We haven't had the equipment that we've needed. Masks are just arriving now. But the dedication and the professionalism of the health services here in Italy, I've never seen anything like it. I've
quite
been here 40
integrated.
years, and it's incredibly impressive.
Tell me, why, Italy got such a serious situation?
I think it's no one knows exactly for sure, but evidently some of the first travelers from China, from Wuhan, arrived in Italy and northern Italy. You know that northern Italy is the locomotive, the powerhouse of Italy. Northern Italy accounts for about 40% of the GDP.
Yes,
so it's heavily industrial, densely populated.
I see.
Cities like Milan and northern cities in the Veneto region. And that's where the first contamination really took place with the incoming travelers from China. And then it spread very, very quickly. They were saying that 1 or 2 people were responsible for spreading it to maybe 200 people in a matter of days.
Wow.
So it happened very, very fast. And then I think, as in many countries, Hiroshi, it was a very difficult decision to stop everything. We didn't know the details coming from China. And I think what very often happens is people think that, well, it's not going to affect us. It's somebody else's problem.
People are too optimistic for the first time.
Yes, yeah. And so finally what happened is they closed off 2 very small towns.
Yes.
And they did that very dramatically. But they did not close the rest of northern Italy for about a week. And then the governors of northern Italy, the provinces, basically said, we need to shut down everything.
I see. That's a stronger mandate of shutdown, which means the people cannot go out.
Yes.
And there are kind of a penalty?
Yes,
Mm.
and in fact, you have to have a special certificate, a document with you
Mm.
when you go out now, and you
Oh.
have to certify number one, that you do not have the COVID-19. Number two, that you are going out for necessities, and so that would be food or pharmacy,
Sure.
or for work. And interestingly enough, most of the people are really following the guidelines very, very closely. And part of it, Hiroshi, is that when you see the work that is done in the hospitals by the doctors and the nurses, everyone wants to help them. And so you realize that you have to do what you can. And people are doing that. It's not easy for a country and a culture like Italy, which is a very social culture,
It's amazing.
a very friendly culture. So it's been a very big challenge, but I'm very proud of the way Italy has handled it.
That's good. Did you have enough ventilators and enough equipment and the PPE? Everything is, that difficult, right?
We have in Italy there is a national health service, as you know, and the national health service basically means that anyone who needs treatment gets treatment. So there's no payment, there's no insurance involved, etc. And it has been very, very efficient in getting people the help that they've needed. To give you an idea, they built a new hospital in Bergamo in 7 days.
Oh.
They set up a new hospital in a convention center in 7 days. So they are doing things that have never been done before. They are getting the equipment that they need. We've been very short of some basic equipment like masks.
Yeah, that's everywhere in the world.
Everywhere. And so now they are just starting to arrive. Interestingly, where we are, and you know this, in Tuscany, the region of Tuscany is very well organized, and they actually went and bought, I think, 30 million masks on their own, and they delivered them door to door. We received 5 masks or 6 masks yesterday at our home, which is just amazing if you think about it. So lots of good things in the system, but lots of challenges.
How about business side? Because particularly you are in Firenze, Florence, and then big problem about the sightseeing and the tourism.
Yeah, it's a very big problem all over, as you can imagine. Our school has been closed for a month.
Yes.
We hope to reopen in another month, but many of the programs that we do, teaching of English and teacher training and inbound, basically, they are frozen until September.
Wow.
We're fortunate because, we have resources and we're a private school, but businesses, especially businesses that depend on tourism in a city like Florence, are suffering. And hotels are shut, restaurants are shut, all of the stores.
Government is asking promptly about the package.
Yes. They have passed 3 bills that are helping people: unemployment bills, stimulus bills, disaster relief bills. And now Italy is hoping that Europe will contribute to this, because the same situation, as you know, is terrible in Spain.
Yeah.
It's starting in Germany.
Exactly.
Now in Holland and Sweden. And so Italy is hoping and working very hard to get Europe involved in this rescue package. It's not easy.
It's a kind of ironically, but of course, it's a good thing because of this coronavirus, Europe might be integrated again.
Yes, yes. I think it's sometimes it takes a crisis to bring countries together, and I think what Europe is understanding right now is that if it's really going to be a community, it has to come together to help all of the different member states.
Tom, lastly, just would you please give your comment to the Japanese and also other world based on your experience and also based on the Italian experience? Do you have any comment to the people who does not have that experience?
Yeah, I think what I can say very honestly is that we have to do something dramatic as soon as possible.
Okay.
And Italy did this very quickly. Some people say it wasn't quickly enough, but my recommendation to any country is to take an extreme measure to stop it, because the sooner you do that, the sooner you will come out of it. And the consequences are terrible. The impact on businesses and your personal life and social life is terrible, but there is no other solution. It's drastic medicine. Do it now and make sure that it doesn't come back.
I understand. This is a good lesson.
Yes, yes. And I think also people need to feel united and they need to come together. It's not a time for politics. It's not a time for saying who was right or who was wrong or we should have done this. It's just a time where everyone has to make sacrifices and try to build a better world.
Yeah, it was a really deep crisis. So you got a lot of lessons already. Thank you so much.
Yes, you're very welcome. It's for me as an American living in Italy, I'm very proud that Italy has managed this crisis as well as it has. I think it's an example for the rest of the world.
Okay, thank you very much, Tom, and stay safe. And I hope everything will be really getting over soon.
Thank you, Hiroshi. I appreciate talking to you, and I wish you the same.
Thank you. Okay, bye bye. はい、今回はですね、本当にヨーロッパの中でも一番大変だったイタリアですね。なんとかね、ピークは超えて少しずついいニュースが入り始めているというのがまさにね、本当に春が来かけているっていうかな、そういう雰囲気をトムの声から聞くことができました。で、彼からね、学んだことっていうのは大切ですね。つまりね、どういうことかというと、これだけたくさんの人が死んで、これだけみんな大変だった。で、お医者さんたちもみんな頑張ったと。こういう中でね、もう一度ね、バラバラになりつつだと、ヨーロッパとか人がね、つながり始めているということね。これを彼が感じているということと、それから東京に住む我々とか、または日本人に一つの教訓ですよね。ともかくね、しっかりとしたアクションを早く、徹底的に取る。エクストリームという言葉を使ってましたけど、極端でもいいから徹底的なアクションを取る。これが早ければ早いほど、もちろん経済には打撃を与えるけども、人の命を救えるし、結果としてはその国を救えるんだということを、イタリアとしてはものすごく学んじゃったという彼の言葉は重たいと思いますよね。そういうことをまとめながら、実はね、イタリアだけじゃなくて、これからスペインだとか、ドイツに今までの経験を持ってイタリアの人たちも貢献したいなと言っているということですね。大変勉強になるというか、非常に重要なメッセージをいただいたと思います。さてさらに次の国を続けたいと思いますので、楽しみにしていてください。